Thank you for all being here today. My name is Lex Ho, and I'm the Georgia Field Organizer for Moms Clean Air Force. I've lived in the state of Georgia my entire life, and I've seen firsthand the devastating effects that climate change and air pollution are having on our state. Unfortunately, Georgia still has 3 coal-fired power plants and 8 natural gas power plants, like the plant McDonough Atkinson behind us. All of these power plants dump massive amounts of pollution into our air, which threatens public health and worsens climate change, while wreaking havoc on the health and well-being of the fence-line communities around these facilities. But the Environmental Protection Agency has the authority to protect us from the harmful soot, methane, and carbon pollution that these power plants spew, and we call on them to take swift, bold, and decisive action to safeguard our communities across Georgia and across the nation. Moms Clean Air Force is a community of over 1.5 million parents and caregivers, including over 31,000 members in Georgia, united in the fight for clean air and climate action to protect children's health and their future. Our members from across the country have spoken up time and time again to demand that the EPA update and strengthen their soot, methane, and carbon rules as soon as possible to create the strongest possible rules to combat these forms of health-harming and climate-warming pollution from power plants. When I testified at the EPA's public hearings earlier this year, I emphasized the compounding health effects of air pollution. Soot, methane, and other toxic air pollution that are released from power plants contribute to asthma attacks, respiratory illnesses, heart attacks, preterm birth and low birth weight, impaired immune systems, cognitive effects, and even lung cancer. And communities of color and low-income communities are more likely to live near these dangerous facilities. Take this in conjunction with the fact that Georgians, especially Black and brown folks, are already experiencing some of the worst health outcomes in the country, as we rank 4th from the bottom for health outcomes across the U.S. To me, these facts make the connection between health equity, environmental justice, and racial justice very clear, and we call on the EPA to act accordingly by strengthening pollution safeguards now. Additionally, methane and carbon pollution, which are both spewed by power plants, are 2 of the most potent forms of pollution that drive climate change. We're already seeing the impacts of climate change in Georgia as extreme weather events like hurricanes, tornadoes, thunderstorms, and more continue to worsen and become more frequent. Climate change is also driving more frequent air quality warnings as heat from higher temperatures mixes with pollutants that create ground-level ozone, which is dangerous to breathe and can further impair lung function, trigger asthma attacks, and even lead to premature deaths. I must also share that kids and young people are particularly vulnerable to the effects of pollution from power plants because their lungs and brain are still developing. Today's children will also live through at least 3 times more climate-related disasters than their grandparents. Moms Clean Air Force knows that we need strong solutions for pollution that cut harmful pollutants from power plants for the sake of our children's collective future. Every day that passes without further EPA protections is a missed opportunity to protect our kids, our health, and our climate from so much dangerous pollution. Updating these standards is long overdue, and there's no time to wait. Thank you again for joining us here today to demand that the EPA fulfills their mission of protecting human health and the environment by finalizing these crucial life-saving air pollution rules as soon as possible. Thank you. Up next, we have Mengistab at the Alliance of Nurses for Healthy Environments.
Thank you, Lux. Good morning. My name is Jessica Mengistab. I'm the Program Manager for Climate and Clean Energy Advocacy with the Alliance of Nurses for Healthy Environments. The Alliance is a national network of nurses and nursing organizations working at the intersection of human health and the environment. Our members work to inform and educate patients and communities on how environmental factors influence health, while advocating to support protections that will make those threats less likely. I'm also a registered nurse, having worked in maternity and labor and delivery for the past 8 years. In my role with the Alliance, I've worked with dozens of individual nurses and nursing organizations nationwide, advocating for public health and environmental protections from federal agencies like EPA that science shows are necessary to address the climate crisis and ensure a healthier future for all. Power plants like McDonough Atkinson are responsible for roughly 1/4 of climate pollution in the U.S. Beginning this year in Georgia, we experienced the 3 hottest consecutive months in our state's 129-year history of record keeping, averaging over 6 degrees higher than what's ever been recorded. This summer, we've also experienced the unrelenting, dangerous heat waves that span across the entire country, and the hottest summer month of July ever recorded in history globally. Now, what do these extreme heat spells mean to me as a nurse? In my practice as a labor and delivery nurse, it means more potential for pregnant patients to experience dehydration and heat stress, higher incidence of observation visits and hospital admissions for treatment, causing disruptions to daily life and maternal stress. Extreme heat can also mean higher rates of early labor and preterm birth, which for my colleagues in neonatal intensive care means greater numbers of babies admitted and needing extensive care for that delicate period where intrauterine growth and development is now happening outside of the womb. We can no longer deny the health impacts of the growing climate crisis. We've now found ourselves in the crucial window of action and implementation of solutions for pollution sources that are negatively affecting our health and fueling the climate crisis. More than half of power generation at plants come from burning fossil fuels like coal, or in McDonough-Atkinson's case, natural gas. Pollutants like particulate matter or soot, climate warming emissions like carbon and methane, and other hazardous air pollutants that cause and worsen chronic health conditions are spewed daily by power plants like McDonough-Atkinson. Volatile organic compounds like benzene that are released with emissions from power plants are linked to a laundry list of conditions like asthma exacerbations and other respiratory diseases, cardiovascular diseases, increased risk of cancer, developmental problems in children, as well as birth defects. Fossil fuel and utility interests will do all they can to influence the EPA and the public before rules to safeguard against pollutants are finalized. A simple, effective marketing tool of labeling fossil fuels as clean-burning natural gas, when we know of their dangerous climate warming potential, is a prime example. We need to meet the opposition with a strong call from all of our communities, urging the administration to stick to their commitments to cut climate pollution by 50 to 52% by 2030, while finalizing the strongest possible rules as swiftly as possible. Nurses are urging the Biden administration and Environmental Protection Agency to not put polluters before people, and set strong pollution standards that will clean up our air and usher in the necessary transition to clean, renewable energy. And now I'm going to turn it over to Dr. Mellinger Birdsong from Mothers and Others for Clean Air.
Give her the mic. I hope that's good. Okay, my name is Dr. Mellinger Birdsong. I'm a pediatrician who specializes in environmental public health. I'm the medical and health advisor for Mothers and Others for Clean Air, a very small nonprofit here in Atlanta that was founded by two moms who care about children and children's health. Children do not choose where they live, where they go to school, or whether the air they breathe is clean and healthy, or whether they have a stable climate that will support their growth. Our job as adults, all of us, is to make sure children can grow up healthy. EPA's job is to set pollution standards to protect health, and especially the health of the most vulnerable, including children. Methane gas is a fossil fuel, and burning it creates dangerous air pollution and dangerous carbon pollution, or greenhouse gases. For years, the gas industry has hoodwinked us and portrayed methane as clean, modern, and healthy, even calling it natural, but it isn't. It's a fossil fuel. All fossil fuels are dirty. It's just that some are dirtier than others. Methane gas power plants continue to dump pollution into the air we breathe, damaging our health and our children's health. Methane gas power plants produce lots of air pollution that damages health and even causes deaths. These include nitrogen oxides, particulate matter or soot, sulfur dioxide, and carbon dioxide. Nitrogen oxides cause asthma attacks. They affect people with emphysema and other lung diseases, and they also turn into particulates and ozone in the air.
From production through its final use, methane gas affects health. There's a whole article called "The False Promise of Natural Gas" in the New England Journal of Medicine that details many of them. In addition to that, last year a study came out showing that children who live near fracking wells have 2 or 3 times the rate of leukemia as children who live farther away. So we know that even from production and fracking, it causes health harms, and through its pipelines and through burning it, like in Plant McDonough behind me. Methane is also a more potent greenhouse gas than carbon dioxide while it's in the air. It contains contaminants that are themselves toxic air pollutants, such as benzene, toluene, xylene, and cyclohexane. Many of these pollutants can cause cancer. 2 years ago, the World Health Organization stated that climate change is the biggest health threat facing humanity. That same year, over 200 medical journals worldwide, including the well-known New England Journal of Medicine, published a commentary calling for emergency action on climate change in order to protect health. Numerous medical professional societies, including the American Medical Association, the National Medical Association, the Pediatrics, Internists, Family Practice, and Emergency Medicine Associations, and many others, have all adopted policies declaring that climate change is a significant threat to human health and a health emergency, and we need to take action now to clean up the air. We have all seen with our own eyes the disasters happening this year and in the last several years all across the country from one side to the other, and these disasters are enhanced by climate change. Floods, storms, hurricanes, wildfires, and too much rain, too much snow. Almost every state in the country has wildfire smoke pollution in the last several years, some of it high enough to make the air look like a doomsday movie, with air quality measurements in many states that are in the very unhealthy or hazardous range. It's clear that methane gas power plants are not clean. They have been harming us and causing death for decades, and they are contributing to climate change, which is causing disease and disruption now and in the future. We need EPA to finalize all the clean air rules quickly to protect our health and our children's health. Thank you. Looks, you come back.
Oh. And thank you again for being here today. Again, Moms Clean Air Force, Mothers and Others, the Alliance of Nurses for Healthy Environments, and the Climate Action Campaign, we urge the EPA to enforce the strongest standards possible to cut carbon pollution from coal power plants. Thank you. Okay, we're good.